Hello and welcome to this Foster Care Institute online training webinar. Trauma and Anxiety Part 2, How to Help Youth in Foster Care. I'm your host, Dr. John DeGarmo, founder and director of the Foster Care Institute. I'm an author of several foster care books, international speaker and trainer, and I have been a foster parent myself to over 60 plus children who have come through the home, who have been a part of my family. And make no mistake, so many teenagers and youth who have been placed in my home have suffered from trauma and have suffered from anxiety. This is part 2 of a 2-part webinar series. If you have not watched part 1, Trauma and Youth in Foster Care Part 1, I encourage you to go back and watch it before you go any further. Our goal during this webinar is to increase your awareness of how to best help youth in foster care who have experienced trauma and anxiety. Our key objectives are to increase your awareness of trauma and anxiety and how it impacts lives, and how to gain an understanding of how to develop and implement trauma-informed care strategies designed to aid youth in crisis. Now, as you most likely know, and as we've discussed here several times at the Foster Care Institute, when youth are placed into a foster care environment, a foster care setting, a residential home, a home where you work at, many times there is confusion. They may simply not understand why they've been placed into yet another home. When youth and children in foster care move from one home to the next home to the next home, it is known as multiple displacements. And it's quite likely that some of the youth that you're working with do not understand why they are placed at your home facility. Confusion abounds. Some youth may see it as an irrational or an illogical move. There may be some youth that you work with who are blaming themselves. Perhaps they blame themselves for being moved from one home to the next over the year or over the years. Perhaps they might blame themselves for their parents' addictions or their parents' abuse, or maybe even for their parents who are incarcerated. There may be some youth who you are working with who may feel they are no longer loved. And there may be some youth who may feel they have been abandoned. Abandoned by their birth parents, abandoned by their biological family members, perhaps abandoned by older siblings or grandparents or aunts or uncles, abandoned by other foster parents, abandoned by former caseworkers, abandoned by the system. Now, before we look at how we can help youth in foster care who have suffered from trauma and anxiety, it's important for us to quickly review why children in foster care might experience trauma. And we're going to review some of the most important points from part 1. Again, if you've not watched part 1 in this 2-part series, I encourage you to do so before you move forward. The National Children's Traumatic Stress Network defines traumatic stress as the following: the physical and emotional responses of a child to events that threaten the life or physical integrity of the child or someone critically important to the child. And again, thank you to the National Children's Traumatic Stress Network for this definition. As you may recall, complex trauma occurs when the trauma continues. The traumatic event the child experienced or the youth and teenager experience continues through the repetition of similar events, events that were similar to the original traumatic event. Or complex trauma also occurs through the accumulation of separate traumatic events. Complex trauma also happens over a period of time, a long period of time. And as complex trauma continues to happen over and over and over again, This traumatic event only reinforces the learning of that trauma or the learning of the anxiety within the child or the youth. Let's briefly review the 3 E's of trauma. There is the event. The traumatic event includes forms of abuse, domestic or community violence, accident, natural disaster, or even war. The next E is the experience. Now, the experience, the traumatic experience, is often difficult to measure because it may relate to how the youth or teenager reacted to the original event. Now, the experience might differ from one youth to the next. It might differ between different cultures or different genders, and it also differs between age groups as well. And finally, there is the effect. The reactions a person has to a traumatic event is the effect. Now, this experience can change, or this experience can alter the teen's well-being and their behavior, both their behavior in the current time or within the next few days, as well as in the future, whether it's in the few days, a week, a month, a year, or years to come. And as you can imagine, the effect, the traumatic effect, can indeed have long-term impact on the development of children and teens. Now, as you know, there are many different types of traumatic experiences. Perhaps some of the youth that you are working with in the home are placed there because of prolonged separation between family members, maybe even the death of a family member. Most likely, some of the youth in the home you're working with have experienced various forms of abuse and or witness of abuse to others. There might be some youth who have come to the home because they were abandoned or are homeless. Other traumatic experiences include drugs or alcohol in the family. Perhaps some of the teens you're working with have been neglected. We mentioned abandonment earlier on. And another traumatic experience can be the imprisonment of family members. Indeed, this can be a traumatic event for a child or a teen. We mentioned earlier multiple displacements. Placement disruptions occur when a child has been moved from one place to the next over and over again. And these placement disruptions have their side effects, if you will. Many youth or teens who have been disrupted over the course of several years in their life, from one home to the next, from one setting to the next, experience emotional, psychological, or social effects. Their mental health is threatened with multiple disruptions. Indeed, to be sure, many youth who have moved from one home to the next have issues of trust, have issues of attachment. They may have issues of trust with you and your fellow staff members. They may have a difficult time forming healthy relationships or attachments with others their age, or perhaps with other staff members, or supervisors, or CASAs, or guardian ad litems. And in truth, the academic performances of those teens and youth who have been moved from one home to the next are generally traditionally lower than your traditional student. On average, youth in foster care are 18 months behind academically and suffer from reading and math skills. And this is due indeed much to placement disruptions. Post-traumatic stress disorder, PTSD, is an anxiety disorder occurring after someone has experienced or witnessed an extreme traumatic event. And the individual, the teen, might feel overwhelmed. They might feel overwhelmed with fear. They may feel overwhelmed with terror or even feeling helpless. Separation anxiety, the more a teen is moved from one home to the next and one school to the next, the more the anxiety increases. When a teen is separated from their family, when they're separated from their friends, this creates anxiety. And those youth placed in the home that you're working with, who have undergone multiple displacements, well, it makes it very difficult for them to form any sort of relationship. And when this happens, many times youth may place walls, if you will, walls to separate themselves between themselves and others, to separate themselves from the pain. Disinhibited social engagement disorder, known as DSED, is an attachment disorder where youth actively approach strangers, people who are unfamiliar with them, in an attempt to interact with them. And as you can imagine, this is something that happens online often. Those youth who have attachment disorder, such as DESD, are going online interacting with strangers in an attempt to find some sort of nurturing or affection. Indeed, DSED may develop due to the lack of nurturing or affection from others, particularly from a main caregiver, during their initial formative years. Reactive attachment disorder, otherwise known as RAD or RAD, is an attachment disorder like DSED where youth are unable to form healthy relationships and attachments with a parent or a caregiver or a staff member. And reactive attachment disorder may result from abuse or neglect early in the teen's lifetime. For much more on this, check out our webinar on reactive attachment disorder here at the Foster Care Institute. Indeed, we examine both DSED, reactive attachment disorder, and other traumas and disorders in the book The Foster Care Survival Guide. And other traumas and disorders include depression, adjustment disorder, attention deficit hyperactivity disorder, commonly known as ADHD, acute stress disorder, obsessive compulsive disorder, and eating disorders. As we've said here several times at the Foster Care Institute, and perhaps you've heard me say in person, it's important to go over this once more. It's important to be reminded of this. Youth, the youth who you are working with, the youth who have experienced tremendous abuse, who have been abandoned, who have been neglected, those youth who have suffered tremendously over the years that you're working with are doing the best they can. When that youth is yelling at you and screaming at you and calling you names, remember, they're overwhelmed with the trauma and they're doing the best they can. When that youth is putting up walls between you and him, remember, he's doing the best he can. So how do we help? How do we help those youth that we're working with who have suffered from trauma and experiencing anxiety? Well, perhaps most importantly, it's a reminder to not take their behavior personally. As one who has had many teenagers in my homes over the years, you can imagine I have had many teenagers who have displayed anger towards my wife and my family, who have ignored some of our rules, who have had shouting contests or have tried to have shouting contests, who have called us every name in the book. It's important for me to remember it has nothing to do with me. It has everything to do with the child's trauma. This is the same for you. When that youth is refusing to follow the rules and the expectations placed upon him, rules and expectations and policies of the residential home, rules and expectations of you and the supervisor, when they're refusing to do so, it has nothing to do with you. It has everything to do with their trauma. When the youth is yelling at you or calling you names, it has nothing to do with you. It has everything to do with their trauma. When that youth has locked themselves in her room to spend some time by herself, remember, it has nothing to do with you. It has everything to do with her trauma. For you see, these youth that you're working with, these youth you're caring for, they're trying their best to hold on. They're trying their best to survive as they have bounced from home to home to home, as they have been abandoned in their minds by those who supposedly love them the most, their family members. So those who have experienced abuse beyond your imagination, remember this, they're trying to survive in an environment that they do not want to be in. Their behavior has nothing to do with you, it has everything to do with what they're feeling and what they're experiencing and what they've experienced in the past. Just like there were 3 E's of trauma, there are 4 R's when it comes to trauma-informed care. And these 4 R's come to us from the Substance Abuse and Mental Health Services Administration. The first R is to realize. Realize the widespread impact of trauma. The widespread impact of trauma in the child's and youth's life, and understand all possible paths for recovery. For you see, there's not one simple path of recovery when it comes to trauma and youth you're working with. There are many different possible paths for recovery. So the first R is to realize the widespread impact of trauma on the child's life and understand that there are many paths for recovery. The second R is to recognize. Recognize some of the signs and some of the symptoms of trauma. And we went through that in part 1 of this 2-part series. So the second R is to recognize some of the signs and symptoms when the teen is exhibiting some of those signs and symptoms. The third R is to respond. We respond when a child or youth is experiencing anxiety by fully integrating all of the knowledge that we have about trauma into the policies, the practices, and procedures when it comes to working with youth in crisis. So the third R is to respond with all the knowledge we have and to put that into place. And the fourth R is to resist. When we're working with youth in crisis, we need to resist re-traumatizing the client or the teen, and also to resist traumatizing part of our staff. One way to help teens in crisis, teens who have experienced trauma and anxiety, is to place safety as a priority. To be sure, teens need to feel safe. They need to feel safe in an environment not of their choosing. Remember, most likely they did not choose to be placed into a foster care setting. Most likely they did not choose to be placed into the home where you work at. So they need to feel safe. Yet they can be triggered unexpectedly in ways that you might not be aware of. Perhaps are triggered by noises. Perhaps are triggered by the nighttime or darkness. Again, in ways that you might not have initially expected. So it's important to remind them that they are safe. To ensure safety. To let them know that nothing is going to hurt them at the house. That no one is going to come there and take them away. That no one's going to come there and hurt them. That they are safe and you are looking after their safety. And you might need to remind the teen of this several times a day. You may need to remind them in the morning, perhaps in the afternoon. Pop your head in at night in their bedroom and remind them that they're safe and you're looking after them for the night. It's important for us as trauma-informed care to approach and identify trauma-related needs. We need to learn and understand how the teen and his family have been impacted by trauma and traumatic events. Remember, knowledge is power, and the more knowledge we have about the teen and his experiences, well, quite simply, the more equipped we can be to help him during these challenging times. So if possible, learn more about his trauma and the family events. Find services for the teens that are based on his unique circumstances. Remember, how everybody experiences trauma is different. The experience is different for each one. Thus, we need to find services for those differences, for those unique circumstances. It's also important to remember that even though a teenager might be 16 years of age, he might not have 16 years in regards to maturity and emotional stability. So when we have conversations with those who've been experienced trauma and experience anxiety, we need to make sure our language and our conversation, it's age appropriate, if you will. If a teen is 16 years of age, but working at a year 10 mentality, or maybe a 4th grade level, even though he might be in 8th or 9th grade, we need to approach our conversations with that in mind. We do not pull out the dictionary and the thesaurus and use every big word, so to speak, that we can find when it comes to working with trauma in a child or a teenager. We need to use conversations that he understands. We need to use words that he understands and are appropriate. Now, caseworkers and staff members and your supervisors and agencies should support and provide trauma-based services and education not only to the youth, but if possible, to their families. Remember, the end goal of foster care is reunification. And while it might be that many of the youth that you're working with may never be reunified with their family, it's still important, if possible, to provide services and education for his family members. We also need to recognize a trauma in the family history. And if the youth that you're working with have been split up with their siblings, again, if it is possible and if it is safe, support those relationships of the teens with his siblings. Maybe the teen has some prior relationships with former foster parents that are healthy and positive, prior relationships that are healthy and positive with teachers or church members or former case workers. Well, if that is the case, try to support those relationships by continuing those relationships through conversations, through visitations, etc. Compassion fatigue, otherwise known as secondary traumatic stress, is something that many caseworkers, many staff members, many caretakers, those who take care of others, and you are a caretaker as you take care of these youth in crisis, many caretakers are susceptible to compassion fatigue or secondary traumatic stress. We have a whole webinar on compassion fatigue or secondary traumatic stress at the Foster Care Institute, and we also dive deep into it into the book, The Foster Care Survival Guide. It's important for you to recognize when you might be suffering from secondary traumatic stress and to make sure that you get the support services that you need. Because as you well know, working with youth in crisis on a day-to-day basis can be physically, emotionally, and mentally draining and exhausting. And you might be at the point now where you are exhausted. You might be experiencing compassion fatigue. If that is the case, find help. If you note or notice that some of your fellow staff members are experiencing what might look to be compassion fatigue or secondary traumatic stress, find help for them as well. Provide help for your fellow caregivers. As we mentioned a few slides ago, perhaps some of the youth that you're working with and living at the home have healthy relationships with other adults in their life. Well, as we know, it is necessary for youth to form a healthy relationship with at least one main caretaker, with at least one adult figure in their life in order to develop socially and emotionally. And many of those relationships might be, as we noted earlier, caregivers, foster parents, caseworkers, CASAs, mental health therapists, perhaps even juvenile judges or church members, if they have healthy relationships in the past, and those relationships still do exist, then it can be helpful for youth who have experienced trauma and anxiety to help foster those relationships, to help encourage those relationships. There may be those times, there may be those moments, there may be those days where sometimes the youth that you're working with, the youth in the home, are filled with anger, filled with rage, and are yelling at you, maybe even being aggressive towards you or towards others. Your response is critical. You do not do the same. You need to avoid yelling at the teen when he's yelling at you. You need to avoid being aggressive towards a teen when he is being angry with his words and actions towards you. Remember, do not take it personal. Instead, lower the tone and lower the intensity of your voice. Do not respond in kind. Do not yell back. Do not threaten. Indeed, do the opposite. Lower your voice, lower the tone. If he's sitting down, sit down with him. Use simple words. I see that you're upset. I can hear that you're angry. Help him to remain or help him to come to a point of calm. Help him develop breathing techniques. Breathing in slowly, with a count of 3 or 4, and exhale slowly through the nose. Breathing in slowly through the nose and exhaling slowly through the nose. Help him to remain calm. Help him to build relationship skills. Tell him it's okay to feel the way that he does and give words to his emotions. For example, I see that you're angry. That's okay. I can hear in your voice that you might be upset. I understand. That's understandable. It looks to me that you're confused. I understand. That's okay to be confused. It can be confusing. Would you like to talk about it? I can see that you are very, very upset. And I understand. That is okay. Again, tell him it's okay to feel the way that he does and give words to his emotions. When you do this, it helps him to calm down. It brings a sense of calm and lets him know that he is safe to have these feelings here and that you are there to help him. Indeed, be there to listen. But you need to be there to listen in an emphatic fashion. We have a webinar here at the Foster Care Institute on emphatic listening. And if you've not watched it yet, I encourage you to do so. Because when you listen to youth and teens in crisis, when you listen to youth and teens who have suffered from trauma, the way you listen is important. And if you listen to them in an emphatic fashion, it goes a long ways in bringing calm. It goes a long ways in helping him understand. It goes a long ways in him recognizing perhaps some of his own trauma. It goes a long ways in building trust and attachment. Never overreact to what he might say to you. Never be critical of what he has done, or perhaps be critical of what his parents may have done. You do not say things like, oh my gosh, I can't believe you said that. How dare you? Do you know what you've done? You're going to be in a lot of trouble now. No, you do not. Instead, you nurture and comfort him in an appropriate manner. Now, it is important to note this. You need to ask your supervisor what is an appropriate manner when trying to nurture or comfort a teen in crisis. Ask your supervisor what is appropriate and what is inappropriate if you are confused, if you do not know. One way to help youth who have experienced trauma is by providing consistency. It's very likely that some of the youth that live at your home have never experienced consistency or structure in their life beforehand. And consistency and structure goes a long ways in providing a safe, stable environment. So be consistent with your meals. Be consistent on what time mealtime is, breakfast, lunch, and dinner. Be consistent when it comes to structured times for playtime or for chores or for homework. At the same time, it's also important to remember the key of flexibility. Even though mealtime might be at 6 o'clock at night every night, perhaps there's a special movie on over the weekends that you could sit down and watch together. Instead of staying in bedtime being 9 o'clock, maybe there is a special sports event at a local high school in the area that they want to go to. Learn the art of flexibility. Do not be rigid in your structured day. At the same time, it is important to have consistency, have routine, have structure. Routine and structure go a long ways. We mentioned earlier the importance of keeping teens safe, reminding them and ensuring their safety. Again, this is something you might have to tell them over and over and over again. If you see that he's becoming upset, if you see that she's becoming confused or scared, look for those signs and record those signs, document those signs. At the same time, when you see behavior, when you see progress in his behavior, record those as well. Have a recording, this documentation, so you can have this on hand when your supervisor asks for it. Provide choices can go a long ways. Would you care tonight to help make spaghetti, or would you like to help make a homemade pizza? Would you like to stay up 30 minutes later tonight watching the game, or 30 minutes later reading a book? Saturday morning, would you like waffles or would you like pancakes this morning? Some small choices go a long ways in helping youth in crisis. It gives them a sense of control. They are in control of that decision for breakfast. They're in control of making a decision whether to stay up late watching a basketball game or reading a book. They are in control when it comes to helping prepare the meal. Those small choices can be very big in the eyes of a teenager who feels he has no control. Remember, he has no control of being removed from his home. He had no control of being abused or neglected. He had no control of being abandoned. He had no control of being removed from one foster home to the next, the next. He had no control of being placed in the home where you work at. And that's upsetting. That's challenging. That's troubling. That causes further and additional anxiety. When you give him those choices, it helps to retain a little bit of control in his life. Another way to help yourself is by continuing to learn, to seek resources, and ask for help when you're working with teens in crisis. Don't be afraid to ask your supervisor or another staff member when you're facing a troubling or challenging moment. Hey, we all love to hear words of praise. We all love to hear that we've done a job well done. Our teens need to hear the same thing. Even though they might not show that they appreciate it, even though they might have that thick skin, so to speak, or appear tough as nails, so to speak, even though they appear they don't like to hear compliments, deep down we all need to hear words of praise in every way, at all times, every single day. The teens that you're working with deserve and need to hear words of praise from you every single day. Find ways, find opportunities, find moments to praise him. And there's a long list there. Remember, the saying, "Sticks and stones may break my bones, but names will never hurt me," is a lie. Words hurt and words can heal. The teens you're working with need to hear words that heal from you. As we've discussed here in several webinars at the Foster Care Institute and in the book, The Foster Care Survival Guide, there are other forms of treatment, of therapy, if you will, that you can include at the home. Play therapy, music therapy, art therapy, animal or pet therapy are all forms of therapy that you can include at the home. For much more on this, check out the book, The Foster Care Survival Guide, or watch some of our other webinars here at the Foster Care Institute. Perhaps the teens that you're working with would benefit from group therapy or group support. They might even benefit from medication. We'll look at medication in a moment. But there are other forms of treatment. Eye movement desensitization and reprocessing, EMDR, allows trained therapists to use a teen's rapid eye movement instead of talk sessions to help the teen deal with traumatic events. Cognitive behavior therapy, or CBT, allows, once again, trained therapists to teach youth to recognize their thought patterns and how to use problem-solving skills to better help themselves. Perhaps there are some trained therapists who work with EMDR or CBT in your area, and if so, talk to your supervisor about the possibilities for some of your youth. Now remember, your youth might be triggered, so to speak, from noises or sounds or the dark or something unexpected. and that trigger might result in the teen lashing out or withdrawing. Be on the lookout for those triggers. Identify those triggers. Look for patterns in the youth. When he's having those moments, be emotionally and physically available for him. Remember, you're there to listen in an emphatic fashion when he's having those moments. Be ready. Put down the computer, put down the phone, stop what you're doing. He needs you to listen to him. Not to criticize, not to overreact, not to offer solutions sometimes just to listen. As always, remind him it's normal to have many feelings and anxieties. Remember, a teenager is in the years where there's many hormones, and they're trying to understand those hormones. For those youth who have experienced trauma before coming to live in the home, well, their trauma, in addition to those hormones, that can create a lot of problems. So remind him it's normal to have those feelings. Remind him it's normal to have those anxieties. Now, when you're working with youth in crisis, when you're working with youth who've experienced trauma and anxiety, be realistic with your expectations. Do not expect him to recover, so to speak, in a few days' time. Do not expect treatment and therapy to quickly fix everything, to resolve all of the issues. It takes time. It may take years. It may take the rest of the child's life. Don't expect that simply loving the teen to be the quick fix either. Yes, unconditional love goes a long ways, but love does not heal all wounds for the teen. Remember, when you're working with teens, one thing you can do is allow him to be a teen. Allow him to be a teenager. Allow him to play. Allow him to socialize. Help him develop work skills that most teenagers may have in that age group. Encourage him to use his imagination. Hey, it's okay to go outside and to get a little bit dirty. Play therapy can go a long ways. We mentioned medications earlier. Medications can be used to treat behavioral concerns. The real work, though, the real work and the real healing is done through various forms of therapy. Medication can be used to treat, but the real healing is done through various forms of therapy. If you are giving medication to a youth, always consult with a doctor and your supervisor before giving teens any medication. And of course, you should be documenting any time you give a teen medication, documenting when, where, what dosage, how much, and what you're giving to the teen in a documentation form of some sort, in a medical log for the youth. If you do not have one, talk to your supervisor about such form. But always consult with a doctor and supervisor before giving any sort of medication and document it. For much more on this, go to the website drjohndegarmofostercare.com. We have many more resources, articles, videos, webinars, podcasts on trauma-informed care. Follow me on Facebook, Dr. John DeGarmo, the Foster Care Institute. Follow me on Twitter at Dr. John DeGarmo as well. If you have questions about this webinar or anything else I can help you with, please feel free to email me at drjohndegarmo@gmail.com. Hey, we all need a little bit of inspiration and motivation from time to time. The Little Book of Foster Care Wisdom, 365 Days of Inspiration and Encouragement for Foster Care Families, might be the book that you need. This book offers you some tips every single day as well as words of inspiration and motivation. It might help you get through some difficult moments. And we have many best-selling foster care books at the Foster Care Institute. I'm sure there's a book available right now that fits your needs. I want to thank you. Thank you for what you do. Being a foster care caseworker, a foster care staff member working with youth in crisis, a caretaker, your job, what you do is difficult. And it might appear, right, the youth you're working with don't appreciate it. It might appear that what you're doing is making no difference, but I assure you that's not the case. What you're doing is making a difference. What you're doing is impacting the teen's life. You might not see it, they might not show it, but what you're doing, they feel it. They understand that somebody does care about them, and that goes a long ways. So thank you for taking some time watching this webinar. Thank you for what you do at the home, and thank you for caring for children and youth in crisis. For the Foster Care Institute, I'm Dr. John DeGarmo.